हेलो एवरीवन, एमएससी नर्सिंग प्रीवियस ईयर एग्ज़ाम का थर्ड पार्ट लेकर के हम आ गए हैं। तो जल्दी से चैनल को सब्सक्राइब कर लें जिससे कि सारी इन्फॉर्मेशन आप तक पहुंच सके एमएससी नर्सिंग बीएससी नर्सिंग से रिलेटेड। तो वीडियो स्टार्ट करते हैं क्वेश्चन नंबर 78 से। इससे पहले के सारे जो भी क्वेश्चंस हैं वो हम प्रीवियस वाले 2 वीडियो में हम लोग डिस्कस कर चुके हैं। तो 78 क्वेश्चन नंबर से स्टार्ट करते हैं। अ पेशेंट विथ symptom indicative of toxic shock syndrome related to tampon use, which of the following is a hallmark clinical manifestation of TSS? What is the nurse should anticipate? The correct answer is option number B, high fever and rashes and hypotension. Next, question number 79. When assessing a patient of uterine prolapse with grading system is commonly which grading system is commonly used to classify the severity of descent? तो इसका करेक्ट ऑप्शन रहने वाला है ऑप्शन बी। क्वेश्चन नंबर 80. A patient has undergone a total abdominal hysterectomy with bilateral salpingo-oophorectomy. What significant changes should the nurse anticipate in the patient's endocrine status post-operatively? The correct इसका जो करेक्ट आंसर रहने वाला है ऑप्शन नंबर बी। देन क्वेश्चन नंबर 81. Which of the following vital sign is significantly elevated above the normal range would be the most immediate concern to a nurse? तो इसका करेक्ट ऑप्शन रहने वाला है ऑप्शन सी। क्वेश्चन नंबर 82. A patient with diabetes mellitus is found unresponsive. The initial nursing action should be the correct answer is option B. Then question number 83. When administering medication via intramuscular injection, the nurse should select a needle length and gauge based on the which of the following factor? The option B is the correct. Then question number 84. Post-operative patient report incisional pain. The priority nursing intervention is to administer prescribed analgesic. The correct option is option C. Which of the following is a sign of fluid volume overload? The correct option is option C. Then next question number 86. A nurse is caring for a patient with nasogastric tube attached to low intermittent suction. Which assessment finding requires immediate nursing intervention? Correct option is option D. Question number 87. The primary purpose of turning and repositioning and immobilize patient at least every 2 hours is prevent pressure ulcer. The correct option is option C. A patient is prescribed warfarin. The nurse should instruct the patient to avoid consuming large amount of food high in vitamin K. The correct option is option C. Which of the following is a common side effect of opioid analgesic? The correct option is option C, constipation. Next, question number 90. A nurse is caring for a patient with urinary catheter. Which of the following nursing action will be prevent a urinary tract infection? The correct answer is option C. Then question number 91. When preparing to administer an intravenous medication to the nurse, the nurse should first check medication level against the physician order. The correct option is option B. A patient with chronic obstructive pulmonary disease is experiencing shortness of breath. The nurse should instruct the patient to breathe using pulse lip breathing. Correct option is option B. Which of the following laboratory value is indicative of hypokalemia? Correct option is option B. A nurse is caring for a patient who is receiving oxygen therapy via nasal cannula. What is the typical flow rate for a nasal cannula? It is about 2 to 6 liter per minute. Correct option is option B. Which of the following is a key principle of patient education? The correct option is option C, assessing the patient's learning need and readiness. Question number 96. A nurse observed that a patient's surgical wound has become red, warmth, and purulent drainage. These are the signs of infection. The correct answer is option C. Question number 97. Which of the following is an example of nursing intervention aimed at promoting sleep hygiene? The correct option is option C. Question number 98. A patient is admitted with dehydration. Which of the following nursing intervention is the most appropriate? The correct option is option C. Question number 99. Ethical principle of autonomy refer to patients' right to make decision about their own healthcare. Correct option is option C. A nurse is caring for a patient who is at risk for fall. Which of the following nursing action is a priority? The correct option is option बी। होप मैं होप कर रही हूँ कि ये वीडियो आपके लिए हेल्पफुल रहने वाली है। तो इस इन्फॉर्मेशन को ज़्यादा से ज़्यादा अपने कॉलीग्स के साथ, अपने साथ वालों के साथ में शेयर ज़रूर करें और चैनल को सब्सक्राइब करें, जिससे कि आपको न्यू अपडेट्स मिलते रहेगी। एंड थैंक यू फॉर द वॉचिंग।